Next we have Dr. John Davis Akkara. He'll be speaking on smartphone eye imaging, anterior, posterior, Gonio, topo, 3D, and even smartphone measurements for ophthalmology. Over to you, Dr. Johnson.
So good morning, everyone. As usual, Sunday morning is a little difficult time for us. So we will be talking about smartphone eye imaging. So this includes anterior segment, posterior segment, gonioscopy, also the corneal topography, the 3D smartphone imaging, as well as measuring. So these are my financial disclosures. Now, no particular financial interest in this presentation, but I have made several apps which are available. And I have a virtual reality headset, and I have plans to make some commercial apps in the future. So right now what is mentioned here, these I have no financial interest in particular. So why click photographs? So you need photographs for documentation, for expert opinion, for teleophthalmology. You needed to monitor progression, regression of lesions such as corneal ulcers, abrasions, SPKs, pterygium nevi, hemorrhages, and so on. And it gives the patients a better understanding of the disease. It is easier to counsel the patients if you show them exactly what you see. For example, a foreign body on the cornea, the abrasions, any ulcers, any retinal lesions. And you can also use software to measure these lesions. It is not very difficult. I'll show you how you can use a software on the phone, an app to measure these things. And why smartphone imaging? Because the best camera is the one that is always with you. It doesn't matter if you have a very expensive top of the line camera which is sitting in a particular room somewhere, if you cannot use it all the time. If you have something which is there with you, which is accessible, portable, allows you to quickly review the photographs, edit the photographs, share the photographs, do online backup, all the while it's being affordable. There is nothing like it. Doesn't matter if you have the most expensive camera in the world, it matters that you have it with you. And for glaucoma, you can take photographs of gonioscopy. These photographs on the sides are done with smartphone. I think this is with the OnePlus 3T. That was many generations back, not the new phone, okay? And you can take optic disc photographs, retinal nerve fiber layers. You can put it in the red-free illumination. You can take slit images of the Van Herix grading. You can take teaching videos of whatever procedure you want to do. So all these things can be taken on your phone. And you can check progression. So you take disc photographs, you can check progression. You have any hemorrhages, disc hemorrhage, you can check the progression. And you can tell the patient, see, this is what disease you have. Give them a photograph immediately on their phone. The doctor-patient rapport is so much better when you have that understanding. And of course, you can, it's very important in disc suspects. So I always give a photographs of the disc to the disc suspects and tell them, see, keep this safely with you. Put your name on it, put it in your email, so that next time I see you, you should show this to me. I always have a backup, but when you give them that responsibility, they take care of their health. In the cornea, you can take diffuse illumination photograph, slit photographs. So slit photographs are a little more difficult. I'll tell you how to take them. You can do photographs of pigments and KPs on endothelium. You can do retro illumination. You can do fluorescein staining. For that, you have to again adjust the brightness and focus. You can take videos of tear breakup time. You can even do clinical specular imaging. Okay, mind you, this is on a phone. On a phone with a slit lamp, good slit lamp, you can take specular imaging, endothelial cells. And there are several adapters available, so many available. This is the one which I commonly use because it is universal and affordable. It's like 400 rupees or something. You can get it on Amazon. There are some which we had 3D printed. This is that same 400 rupees adapter which we were using in Arvind Eye Hospital, Pondicherry, recording a surgery through the side observer scope. So these things are easily doable. If you don't have a camera, doesn't matter, you can still use your phone. And these are some videos which show you how to use it. Quickly go through it. First, open the camera. Let
the
me.
regular camera app will do, and bring the phone to the eyepiece of the slit lamp.
So mind you, there should be a space. You have to keep it near the eyepiece. I usually keep it horizontal like this for stability. I just keep the phone in my left hand, just hook my hand onto the eyepiece. Make sure that the circle is sharp. So when you adjust the phone forward, backward, you get to a point when the circle is sharp. The point where the circle is sharp is the best field of view, best focal point. So you keep that. There is always a space of 2 to 3 centimeters here. I use my fingers, the fourth, fifth fingers to stabilize, ring finger, little finger to stabilize, and I hold the phone with my thumb and index finger, and this is how it works. If you get it right, you can just get pictures very quickly, very rapidly. You can also use the adapter if you want to take videos. I use the adapter if you want to take videos of the retinal examination, so 90D, 78D, and also gonioscopy. But for everything else, I just use my hand. Very quick, very, very quick. If your eyepiece cap can be adjusted forward very well, you can use that as an advantage to give this extra space of 2 centimeters. Once that is done, you can do the same thing as I showed you. You get a clear circle, sharp circle, and for slit, you need to do touch to focus. You make a slit and you long press, and this is fundus, of course. This is 78D, yeah, 78D, undilated, mind you, undilated 78D. You can do this and you can take photos. So here in this, you cannot see it very clearly, but the recorded video was pretty good. If you can do 90D examination, you can take photos with that. And apps, you can use a regular camera. Regular camera app is pretty good, but it would be very useful to have an app for that. So there are some apps like this. There are also apps which let you store the patient details, which we are also updating an app like that very soon. Then settings, flash off, HDR off, AI off, beautification off, portrait mode off. All the extra fittings, you turn it off. You just need the camera in the basic mode. Touch to focus, not touch to click. Metering on touch, that is, it has to adjust the brightness according to the touch. And then you can zoom in to remove all the outside black circle of the slit lamp. It is not required. You zoom in to your point of interest, and you can adjust the slit lamp light for it to be comfortable. Room light, if you can turn it off, well and good. That removes some of the glare and extra artifacts which come up. Exposure, you reduce it to the lowest, which gives you a better image. If you look here, I made a slit to show this vitreous. It's a little difficult to see otherwise, so made a slit, and this is vitreous over here in the anterior chamber. Focus, you long press and then adjust the focus, adjust the brightness also up and down. You can lock the focus by long press. That is the long press thing. White balance, usually automatic works fine. If it does not, if it's white light, you adjust to incandescent. Yellow light, you adjust to halogen. ISO low if for most photos, but if it's very low light, you can adjust it a little high, but you get more grains. So quality reduces, but you get better pictures, better brighter pictures. Shutter speed is faster is better. So you try to get the best of these, adjusting all these. So slit, long press, adjust the brightness up and down. Long press on the point of focus. So you long press exactly here, okay, and then up and down. So that is some Morgagnian sunken nucleus that was there. Pseudo exfoliation at the angle. Again, this is overexposed, so brightness should have been reduced. Here you see a focal decimate detachment at the place where a laser injury happened. PI was being done, there was a laser injury. So that is another thing which is here. And always you may not get entire picture as good, so you might have to edit. So this particular picture, it was cropped to remove all this unnecessary glare. So this is the point of interest. Remove the points which are not of interest. And corneal dystrophies, it's focused on the cornea here, not the iris. So make sure you adjust the focus. So you are playing with light and focus. Make sure you play both properly. Then there can be decimate tears. You make sure that you focus and adjust the light so that the glare does not obscure your point of interest. Then angle of illumination, you can adjust the angle to see things which are behind. See the same eye. Here you cannot see anything behind. By adjusting the light, you can see the fishtail of the posterior polar cataract going into the vitreous. Then you have a traumatic cataract here. You have anterior subluxated lens here. Specular photos can be done with the same technique which you use for specular photography, and you have to focus on the inner illumination. Okay, so here you have to focus on this part, adjust the brightness, adjust the focus, and then you can get pictures like this. And gonioscopy, I don't need to add anything extra. You just have to make sure that you put it on the adapter so that you don't worry about one hand holding the lens, one hand holding the joystick. Do you have a third hand or not? Fundus photographs, you can use different methods. This is with 78D, 90D. You can take fundus videography like this. You can even take images of a vase ring. You see the vase ring here in the shadows. I'll just get back to it. See this? So this is all a play of light and shadows. You adjust the light, adjust the focus. You can take photographs of any of these things. Then of course there is the do-it-yourself red cam, foldable fundascope, Zeiss red cam, made in India red cam. All these can be used to take fundus photographs by indirect ophthalmoscopy method. So there are several options available, and videos in sitting and standing position. So the here, whereas in the sitting position it was not very much visible, right? So these are the other methods for fundus. We saw these pictures already. These are the videos. You can see the sparkling material in this phacolytic glaucoma and the post-op eye. Some uveitis is there. You can see the flow of pigments. 3D, I don't have much time anyway, but I'll just tell you that you can take 3D pictures which can be viewed in the headset. You just look up this particular app, 3D Atlas of Ophthalmology, in the Play Store. You can use that. These are all 3D pictures taken with this app, and you can read more about it there. And images you can measure by using, measure by using this particular app. So if we have time at the end, we will discuss all this in the discussion part. So this is another project of mine where we do measurements by using smartphone apps. So thank you.